Did you know that different poisons require different antidotes? That's right, it's not a one-size-fits-all scenario. From a simple acetaminophen overdose to a deadly snake bite, the antidotes vary widely. It's a fascinating world where compounds battle compounds, each specific to the toxin involved. It's crucial to understand this diversity and the role it plays in saving lives. So let's embark on a journey into the intriguing world of poisons and their antidotes. Let's dive into the world of poisons and their antidotes. First off, let's tackle acetaminophen and organophosphate poisoning. Acetaminophen, more commonly known as paracetamol, is a popular over-the-counter medication used for pain relief and fever reduction. However, an overdose can lead to liver damage. The antidote for acetaminophen poisoning is N-acetylcysteine, or NAC, which works to replenish glutathione, a substance that helps detoxify the liver. Next, we have organophosphate poisoning, a type of poisoning that's often associated with exposure to certain insecticides. The antidotes for this are atropine and pralidoxime, also known as 2-PAM. Atropine reduces the effect of the poison on the body, while pralidoxime helps reactivate the enzymes that were inhibited by the organophosphates. Transitioning to cyanide, a highly toxic substance that interferes with the body's ability to use oxygen. The antidotes for cyanide poisoning include hydroxocobalamin, sodium thiosulfate, amyl nitrite, and sodium nitrite. These antidotes work by binding to or neutralizing the cyanide, allowing the body to utilize oxygen effectively once again. That covers some of the common types of poisoning, but there's more to learn. Moving on, let's explore opioid and benzodiazepine poisoning. Opioids, like heroin and morphine, can lead to severe respiratory depression when misused. Fortunately, the antidote Naloxone can reverse these effects. It works by binding to opioid receptors in the brain, blocking the opioids and reversing their effects. Next up is benzodiazepine poisoning. These medicines are often used for their sedative effects, but can be harmful in large doses. The antidote, Flumazenil, can counteract these effects by competitively inhibiting the action of benzodiazepines on the GABA receptor. Iron poisoning, though less common, can result from an overdose of iron supplements. The antidote, Deferoxamine, binds to free iron and creates a complex that is then excreted in urine. Finally, we have Digitalis poisoning, often due to an overdose of heart medication like digoxin. The antidote, Digoxin-specific antibody or Digoxin-specific Fab fragments, bind to digoxin, neutralizing its effects. There's still more to cover, so stay tuned. Next up, let's discuss lead and carbon monoxide poisoning. Lead poisoning, often resulting from environmental exposure, can be treated with antidotes such as dimercaprol, Succimer, or EDTA. Carbon monoxide, a silent and deadly gas, can be combated with hyperbaric oxygen therapy, a treatment that rapidly eliminates the poison from the body. Moving to antifreeze and methanol poisoning, both of these toxins are often ingested accidentally and can cause severe complications. The antidote for both is fomepizole or ethanol, which work by blocking the toxic effects of the poison. Lastly, let's talk about snakebite poisoning. This is a unique case where the antidote is specific to the snake species. Antivenom, when administered correctly, can counteract the effects of the snake's venom, saving the victim's life. Remember, each of these antidotes should be administered under the guidance of healthcare professionals. We have covered a lot, but there's one more type of poisoning to discuss. Lastly, let's examine rat and mushroom poisoning. Rat poison, commonly containing compounds such as warfarin or coumarin, works by disrupting the normal blood clotting process, leading to internal bleeding. The antidote for this type of poisoning is vitamin K, which aids in blood clotting. On the other hand, mushroom poisoning, specifically from the deadly Amanita phalloides, can cause severe liver damage. Antidotes include silibinin, which protects the liver, and activated charcoal, which helps absorb the poison. Supportive care is also crucial in managing symptoms and preventing further complications. Now, let's transition into the general guidelines for first aid in poisoning. First and foremost, dial emergency services immediately if you suspect poisoning. Stay calm to make clear decisions and, if possible, identify the substance involved. Ensure your safety first and move the affected person away from the source of poisoning to a well-ventilated area. Observe for signs of poisoning such as difficulty breathing, unconsciousness, or seizures. In many countries, there's a poison control hotline you can call for guidance. If required, and you're trained to do so, perform basic life support. Avoid inducing vomiting unless instructed by a healthcare professional. The use of activated charcoal should also be directed by medical professionals. Lastly, do not give fluids or use milk or oil unless advised by poison control, as they can react adversely with certain substances. Remember, in case of suspected poisoning, seek medical attention immediately.